Hi everyone. If you don't know who I am, my name is Dr. Mary Claire Haver. These videos do tend to get shared quite a bit. I am a board certified OB-GYN. I am also certified in culinary medicine, and I have married my passions for women's health and nutrition into my company, the Galveston Diet, which is an online wellness course for women specifically in midlife, specifically to address the challenges that are affecting our bodies at this age. So feel free to share this video, whichever the share link is on the app that you're using. For some of you, it's here. For some, it's there with someone who you think this might be helpful to. But I am going to go through menopause as I know it. So I am 53 years old and I am completely postmenopausal. I probably went through menopause completely, meaning my ovarian function shut down somewhere around age 51. So I've been postmenopausal for 2 years. My perimenopause was a bit of a roller coaster, and I learned a lot of things that I wish I would have been more aware of or taught better in my own residency and training. But it is what it is. And I'm grateful that I could take a deep breath and step back when I was going through the changes and really realize that a lot of the stuff I was taught and trained, I was probably undertaught and undertrained in recognizing symptoms and in what treatment options were available. The other kind of lack in my training was in nutrition, and my undergrad degree is in geology. Beautiful science, absolutely loved it, but not super helpful when it comes to obstetrics and gynecology and women's health. Super interesting on field trips and on family vacations, but I am really lacking in some of my undergraduate knowledge when it comes to women's health. I went back to school and became certified in culinary medicine in 2019. It took me about 18 months to complete 60 hours of coursework, graduate level coursework, along with the labs. And then I had to sit for a board exam, which was really hard, and passed that to become a certified culinary medicine specialist. So now that my credentials are out and everybody knows who I am and why I'm here, I want to walk you through kind of the evolution of what I went through, because I feel like my story will resonate with some of you and maybe help you realize that you're not alone, and that hopefully open up the conversation of perimenopause and menopause amongst your peers, your family, your girlfriends, and your partners, so that the world can be more supportive of this incredible time of what we go through as women. Hi, Blake. So I blissfully was on birth control pills to control another medical issue that I had called Polycystic Ovarian syndrome well into my 40s. And I, didn't have the hot flashes, night sweats. I was starting to gain weight a little bit. Like, my efforts at weight loss were getting more challenging despite being pretty active and feeling like I was eating healthy. But despite no changes in my diet or exercise, I was just noticing that little bit of a creep of weight coming on over time. Nothing dramatic, but just, this is a little tighter. And my efforts at weight loss were getting more difficult. Whereas before I would, diet for a week or two and then boom, the weight would come off and I would feel really good and get back into whatever outfit I wanted to wear for whatever special occasion. But that was becoming more and more difficult. So then we kind of had the great storm in Dr. Haver's life and Mary Claire's life. It was, I got off of birth control pills. I realized I was in the throes of perimenopause. I was on this emotional roller coaster. I was starting to have hot flashes. The weight gain started piling on. And my brother was super sick. So my brother had HIV and hepatitis and was in end-stage liver failure. And he got really, really sick, like terminal, really fast. And that hit at the same time as all of my emotional issues. Plus, so many aspects of my job that I loved and still love to this day, but the administrative burden was becoming really tough. My husband started working overseas and traveling quite a bit, and I had two, like a preteen and a teenage daughter, and I was really just every aspect of my life, I felt like I was getting punched. And so then my brother died, and I was in the operating room when I got the call that he had had a stroke and was not going to make it. And I was operating. And luckily I was operating with a partner. who was very trained, but it was my patient. And they put the phone to my ear, and I think my sister or my mom, I don't even remember. It's such a blur. And I should have never taken that call, one in the middle of a case. And I stopped for a minute. It was a routine case. Like, the patient was fine. Everyone was fine. But I stopped, and I was just like, I got to finish this surgery. I must finish this surgery. I must finish this surgery. And I guess I was repeating those words over and over again, because I knew I had to get in the car and drive home so I could say goodbye to him. And home was 4 hours away. And so, so my partner was like, I'm going to finish this case for you. We were almost done. And he called in another physician, and they tagged me out of the OR. Like, I just had to go. And so, kudos to my partner for realizing I was not myself, and that there were people available to be able to tag me out, so that, patient safety always comes first. But in that state, just to give you an idea of what my emotional state was. So I go home, get in the car. I think I left my phone in the refrigerator. I think I packed like a sandwich in my suitcase. I don't even know what the hell. I threw stuff in a bag, threw stuff for a funeral, threw whatever. I mean, I just got in the car, and we were driving, and I was just crying the whole way home. My husband's trying to drive the car. My kids don't know what to do. They're in the backseat freaking out. So we get there, and by the time I got there, they'd already called hospice and were transporting him from the hospital to the house. And so I was sitting there, like, as a physician and a sister. Like, my sister is a hospice nurse, and I'm a physician, and she and I are like, we can do all this. Like, hospice will come in and do what they absolutely have to do, but we're doing all of his care, And she's like, how long, she and I were like, what do you think, because he wasn't eating, he was in a coma. And so we thought 3 or 4 days before, it's going to happen. So it was a beautiful way to go, because surrounded by family, all of us were there, all of his friends. He had a huge group of friends. We had a house full, singing, telling stories. I mean, it was gorgeous, but I lost my mind. That was the beginning of me just overeating, over drinking, anything I could do to numb what was happening. That my brother was dying. My second brother was dying. And because I'd already lost one when I was 9. And so he dies 3 days later. We have the funeral within a week. Like, I was gone from work for a week. Thank goodness I had the time saved up to be able to do that. And then I get back, and I'm just like a robot at work. I'm doing everything I need to do. I'm there for my patients, but I get home and I'm a total robot. And I just remember, like, going into the pantry and just stuffing my face with goldfish crackers. Okay, so mind you, I'm also menopausal. I'm having hot flashes. I'm not sleeping. I'm going crazy over my brother's death. I am filling my face with processed carbohydrates and wine, and just barely making it. So through that process, fast forward like 4 months, the depression and the grief starts to lift, and I look down and realize I've gained about 20 pounds through all this mess. And I'm like, okay, don't beat yourself up. You've been this big before. You've been this big in pregnancy. You can do this. You can do this. Okay. And I could hear Bob's voice saying, sister, you can't blame your weight on me anymore. It's time for you to get back to you. Like, go back and be fabulous. Stop all this mess. Stop. Enough. Go be happy. Okay. So I do what I taught my patients to do for years. Work out more, eat less. That was the way. That was the only thing I had been taught. That was what I had told my patients for years, even the ones in perimenopause who were like, look, Mary Claire, I am working out. I am eating well. I'm not changed a thing. And what is this? And they're grabbing their bellies and they're shaking it at me. And I'm like, well, in my condescending voice, and I want to shoot myself. And if you were one of my former patients, I'm sorry. I didn't know. Okay. But I've educated myself, and I'm trying to educate the world now. I hit the gym like a boss. Okay. I was 2 a days. I was, just calorie counting here and there, and, I'd lose a pound or two and it'd come right back on. I was like, damn it, it's got to work. So I was calorie restricting. I was in this endless cycle of caloric restriction, excessive exercising, and losing a little bit of weight, but it just coming right back on the minute I slacked off the littlest bit. And I realized one big thing, that I sounded like the patients who would complain to me for years. And I'm like, what the heck is going on? I went back to all my usual healthy habits, everything I thought was healthy. I was eating low I was doing every fad diet at that point. I was trying keto. I even did some vinegar cleanse. I don't even know. Thank God I'm still alive. So it was affecting my home life, as you can imagine. It was a rough 6 months for my family, from the death to all this. My husband was going on a trip. So he works overseas, and he was about to leave on like a month-long trip. And I was like, when you get home, you're going to have the wife you deserve. And I'll never forget this. He looks at me and he said, I love you. I have the wife I deserve, but you are acting a little crazy. I was getting up in the middle of the night when I had to pee to weigh myself. I mean, I was weighing myself multiple times a day, like obsessed, crazy. So he said, listen, what do you tell me? What do you tell the kids? If what you're doing is not working, you need to do something different. He's like, you're a scientist, figure this out. So I was like, So I took that as a challenge. So I called up, so I was employed at a big university in the town that I work in, and I called a couple of people who I delivered their kids who were like PhD nutrition. Yeah. I hate to call them nutritionists because that's like a fake term, but they were PhD dietitians. They had like this is their life. All they do is study food nutrition and the human body. So they were like, well, we know that there's definitely a weight gain issue and a body composition change issue in menopause for women, different than for men. Like men kind of have a steady state and women are kind of trucking along. And then about 2 to 3 years before their periods stop, we see this explosive growth of visceral fat. And I was like, damn, okay. I was like, yeah, I think that's happening here. And I said, how do we measure that? And they go, well, really way to do it is an MRI, but nobody's going to pay for that. And then there's a DEXA scan, but, again, insurance isn't going to cover that to measure visceral fat. But, they have these body scanners that you can go to, find or go to that do a pretty good job. And I was like, all right. And so I said, well, they go, but, a pretty decent way to do it is the waist-hip ratio. I was like, oh, I remember hearing about that. And they said, yeah, it's like a way more accurate measure of health than just doing your weight or your BMI. And I was like, okay, that makes sense. So then they talked to me about, we know inflammation levels are going up. There seems to be some kind of tie, and, but no one's really looking at that a whole lot in women. There's the Women's Health Initiative and the Black Nurses Health Study, and there's a Black Women's Study, and then the Nurses Study. There's a few studies where they looked at like 1 million points of information on women going through perimenopause and menopause, and nutritional things are just kind of anecdotal. So I was like, okay, so I went down the rabbit hole. I read everything I could get my hands on, and I kept seeing this repeated, inflammation. I'm like, okay. I get it. I feel inflamed. And, specifically, then I went down the rabbit hole of estrogen levels. Estrogen turns out to be an anti-inflammatory hormone. Okay. And when you take it away, we start seeing multiple disease states get worse. Not just menopause, perimenopause is so much more than hot flashes and mood swings and night sweats, like the big three. Okay. It is aches, pains, headaches, increasing mental health disorders, increasing autoimmune disease, increased new diagnosis of gastrointestinal disease. I mean, pretty much every single body system is affected. And I'm like, oh my gosh. And not only is weight going up, but body composition is changing. Where we used to most of us, not all, were depositing fat on the hips and thighs. Now it is shifting to 2 years before your period stop, it is absolutely normal, meaning it happens to most women. We see an accelerated deposition of visceral or belly fat. That seems to be not only related to decreasing estrogen, but when estrogen levels decrease, the activity of our androgens, the male hormones increase because steroid hormone binding globulin, which binds our sex hormones and keeps them inactive, decreases. So the activity of our androgens increase. And that seems to be one of the biggest causative factors that is driving fat to the abdomen. So what do you care? Like all of the gym bros get on me and they yell at me and they tell me fat is fat, no, and calorie counting is the way. I'm like, dude, all right, bro. Go talk to your mom. Ask her what happened to her in perimenopause. And did she change a damn thing in her life? Okay. Visceral fat is different. It is metabolically different. And I did not know this until I, read the research. I did not research, meaning I did not do the studies in the lab. I read other people's research. So kudos to all those people. I have multiple links to medical journal articles on my website. You're welcome to go read all the research yourself. I have it all there for you to check out. But I was like, okay. So visceral fat is metabolically active. It pumps out cytokines. Which are inflammatory mediators. And in turn, as visceral fat goes up, it's like you're in this negative feedback. Insulin resistance goes up, leptin resistance goes up. You get hungrier, you're not as full, your cortisol levels rise, and you just end up, and the whole thing feeds in itself, and you're in this negative feedback cycle. So many patients in my clinic now, I'm able to diagnose this condition, and we start with specific nutritional changes to start to reverse this. So let's go back to like the beginning. So I'm reading all this stuff and I'm formulating a plan in my head. Remember, there's no Galveston diet. It's just Mary Claire frustrated with her own weight gain and realizing she might be able to do something to help her patients. So I'm like, all right, so if calorie counting is not the way, I'm not saying calories aren't important, but they're not everything. You cannot equate an apple to a donut, okay? Metabolically, they're going to do very different things to your body. Okay, if you're just joining me, hi. TikTok is making me stop for a second. I'm Dr. Mary Claire Haver. I'm a board certified OB-GYN. I am also the creator and founder of the Galveston Diet. I am certified in culinary medicine, and I'm telling you my menopause story time of how the Galveston Diet was created. So everybody tap the screen twice. Thank you. I have, 1,700 likes. Everybody double tap the screen to like the video. It helps drive the algorithm and keep me pertinent on this. So at any point you want to hop off of here, go, you do you, but stay tuned for the story because I'm just giving you the background. We have a website, galvestondiet.com, where you can go up here to my little picture, click on that, and that will take you to my TikTok page. At the top, there's a link in bio. You can go and learn all about the Galveston Diet, and the sale is still on, 20% off of gold. So go check it out. All right, so I'm like, plan is formulating in my head. I start looking at, okay, let's focus on inflammation. Stop looking at calories. Don't look at, I think the fallacy, and there's multiple articles and lots of research coming out that the paradigm shift of that weight issues are simply because of caloric excess is a fallacy, okay, is a total fallacy. Calories are important, but more important, especially at our age, is nutrition. The quality of your nutrition. And if you are only counting calories, as I learned the hard way, you are not maximizing the efficiency of your body. You are turning different hormones. Hormones control where and how you store fat. And I'm not talking about estrogen and testosterone. I'm talking about leptin, ghrelin, cortisol, and insulin. The top four that control your hunger, your satiety, and where and how you store fat. Those are the ones. And they're more affected by the quality of your nutrition than the amount of calories that you eat. Please, if you learn nothing else from me today, remember this point. So, okay, everyone double tap the screen to like the video, like. Inflammation's terrible. Okay, so I decided to focus, let me just give up calories because it ain't working. And let me focus on things I can do to lower inflammation. I ran across some incredible, I've only been validated 1,000 times since I first read the articles about, and you guys are going to hate this, intermittent fasting and inflammation levels. Intermittent fasting is modest at best for weight loss. It is not considered to be a weight loss program. You can eat a lot of shit in your eating window, okay, and undermine a lot of the medicinal effects. That's why intermittent fasting is only part of the Galveston Diet. The three arms work synergistically together to turn that little train the other way. Okay, now I'm going to give you some tips and point you to some blogs. All of it's free. I'm not here to sell you anything today. So intermittent fasting has medical benefits. It works at the level of the epigenome, okay? It basically, the way it was explained to me in layman's terms, the best way I can explain it, it's like when you're exercising, okay? You need to stress out the body just enough to cause it to become stronger and more resilient. Does that make sense to anybody? When we are hit with an injury, when we cut our skin, we make a scar. The tissue gets thickened, stronger there. When we exercise our muscle, when we do resistance training, the muscle responds by becoming hypertrophic, thicker and stronger. When we exercise our heart, it works by increasing cardiovascular efficiency. This principle goes down not only to a cellular level, but to a genetic level. We can actually change our genes with fasting. Okay, now there's multiple ways to fast. There are multiple ways to get yourself into trouble with fasting, okay, where you're kind of undoing some of the benefits. And so what I have found works best for me and for our students in the Galveston Diet is daily intermittent fasting, is habit building. Changing your life to change your habits so that this becomes an everyday thing. And my students who have kicked fasting's ass are like, girl, I was so scared of it. I swore I was never going to not eat breakfast. I work out in the morning, and guess what? Boom. They are fasting evangelists, and it's like the easiest thing to do in our program. So I also, phase 2 of our program is anti-inflammatory nutrition. What is that? Okay, well, go take the inflammation quiz. It's in the link in bio up here. It's free. It basically will give you a score, and this is based on 2 validated inflammatory scoring systems developed for registered dietitians. Okay, I took them, I did a back of the envelope conversation. It's not perfect, but it's a pretty good estimation of, it's a 24-hour recall. You can take it every day if you need to. It'll give you a score on how pro or anti-inflammatory your nutritional choices were. I learned in my coursework, I have all my books back here from, from my culinary medicine certification. I learned so much that was like blew my mind about what is healthy and what is not, what is pro-inflammatory and what is anti-inflammatory. We don't call foods good or bad in our program. Food doesn't have morality, okay? A one-time donut is not going to kill you unless you're a type 1 diabetic and didn't take your insulin, okay? What is going to set the pattern of health for the rest of your life is the pattern of your nutrition. And let me say that again for those in the back. It's not a one to, everyone wants an easy button. I want an easy button. I wanted an easy button. What supplement? Give me a vitamin. Tell me what to do. Tell me what to take. Guys, it's a pattern. It is a general pattern of your lifestyle. And where I blow people's mind the most is what they thought was healthy turns out not so damn much. Okay? And that we spend hours teaching you about this in the program. All right? So, for example, fruits and vegetables, have so many natural phytochemicals that are natural antioxidants and anti-inflammatories. In the Galveston diet, we talk about eat the rainbow, eat the rainbow, eat the rainbow. Eat as many colors as possible because every single color of food that you eat has a very specific nutritional profile, has a very specific phytochemical that is going to do different things in your body. So, eating the same thing every day may be convenient and probably is better than hitting the drive-thru every day. But if, you are not maximizing on your nutrition unless you are eating as many colors as possible, okay, and as many variety of foods as possible. So the other is learning which things are really anti-inflammatory to everyone. Now, there are things that are going to upset you, that I don't know your personal genetics. You may have lactose intolerance. You over here may have, a protein allergy to some, wheat, gluten, or whatever. You may have celiac disease. We all have specific things to us. But, in our adulthood, we should realize we really can't tolerate I can't do a whole lot of tea. I can't do a whole lot of tea. The cachectins kill me. So red wine, more than 1 glass, I don't feel good, okay? It's not for me. Thankfully, I can drink a whole lot of white wine. So, but everybody has something that is specific to them. But there are things that are going to jack up all of us. Artificial colors, artificial flavors, nitrates, proven in all human beings to be, and I have lists and lists and lists of things there. So, these are the things that need to be avoided. If you go to a party or you're at a social event and that's all they have, eat it. 1 dose is not going to kill you. But if you make it a habit to eat those things on a regular basis, you will pay for it in the long term. You will pay for it. All right. So everyone double tap the screen to like the video. Every once in a while I get notifications from TikTok to try to improve engagement. So, and to introduce myself, I'm Dr. Mary Claire Haver. I'm the creator and founder of the Galveston Diet. I'm also a board-certified OB-GYN physician talking about menopause, inflammation, and weight gain. And I kind of went through my own personal story of how this all happened. And so anti-inflammatory nutrition is second. And the third is something kind of an umbrella we call fuel refocusing. So we focus on the macro and the micronutrients of food to make sure that we are hitting our goals. So a lot of you, especially on, multiple social media platforms now, have seen my video. It's gotten like 10 million views about, tracking magnesium, calcium, vitamin D, omega-3 fatty acids, and fiber, and added sugars. And so if you just did those things, you could dramatically change your life and your health for the better. And so these are some of the things we track. We look at omega-3 to omega-6 ratios. We look at, that's kind of advanced, but when we look at the saturated to unsaturated fat ratios, those simple tweaks, like if you really are, like when I have students or patients who come to me and I'm reviewing with them their dietary habits, And they are really, their macros look good, their micros are, we really start focusing on those micronutrients, and that sometimes is all they need to tweak. But again, it's very, very individualized. Okay, so if you are interested in learning more about the Galveston diet at any point, just go up to the link up here where my little picture is. It'll take you to the top of my TikTok page. There's a link in bio there, and you can take advantage of the sale. It's 20% off the gold program, but whatever. So there's also blogs, quizzes, all kind of free information. And if you have a fabulous OB-GYN doctor who does routine discussion, at least offers pain control with you on a regular basis for your gynecologic procedures, or did fantastic menopause care, please put them in our referral database. We will be publishing it very soon so that you can come to our website. If you're looking for a good doctor who's going to do these things for you in your community, you can find one. Okay, so if you have any questions, remember, drop them in the Q&A. And always, if you want to share this video right here, click the share button. And of course, keep double tapping this video so we will keep sharing the love with our community and our followers. So fuel refocusing, focusing on micronutrients. We also do some mindset work. We work on why are we making the choices that we make? There is often a cultural, a social, and emotional component as to why we fill our pantries with what we put in it, things that we were taught were healthy, things that how to show love, we really kind of try to break down the emotional connection we have to these things and work on strategies to decrease those. We do talk about exercise in our program. We talk about the medical and health benefits and stress reduction of exercise and how important it is as well in our program. So I put these three things together for me, and I tried it on myself. And I was like, well, let's see where this goes. And suddenly it was working. First thing I did was conquer intermittent fasting. That took about 6 weeks. And then I did not to do it overnight. I got great advice. And if you decide to practice intermittent fasting with the Galveston diet or not, I'm going to give you the same advice that was given to me that made me so very successful. Pushing it out in 15-minute increments over 15 minutes, do that for 4 or 5 days, another 15 minutes, 4 or 5 days, another 15 minutes, so that you can become fast adapted slowly. It's just the sizer to make sure that I'm comfortable and it fits, and now I'm just getting used to wearing it. But this is the fake. This is not the real one. This is a sapphire. If you were asking about this one, this was a 15th anniversary. We've been married 26 years. 15th anniversary present from my husband. Also, thank you for we moved to Venezuela 15 whatever years ago, 12, 13 years ago. And it was a struggle for Mary Claire. It was hard. And, for his career, I took sabbatical in mine, and this was like our anniversary, and thank you for not leaving me. And we kind of had a come to Jesus in our marriage, and this was a symbol of our kind of, coming back together as a couple. So, real life. Anybody who's married as long as me knows what I'm talking about. Okay. Oh, the tracking. So the tracking, just go to the blog. If you go to galvestondiet.com or just go up here to the app. So everybody double tap the screen to like the video. Double tap, double tap, double tap. If you go up here to my picture, and then it'll take you to the top of the TikTok page. Hang on. And if you scroll down, you will see the blogs. And it's called the Fab 4 Challenge. It is the most popular video I've ever had on TikTok, Instagram, YouTube, anywhere. And it's about tracking nutrition instead of tracking calories, and it's free. All the information is there. My favorite tracker, everything you need. And this could change your life for free. Go check it out. The Fab 4 Challenge. It's also pinned. It's one of the videos pinned to the top of my page here on Instagram. So let's see. On TikTok, I never know what thing I'm on. So I do. Okay. More questions. Can you be in perimenopause as early as 30? That would be rare, but it's not impossible. That would be premature ovarian failure, which affects a very small percent of the population, but it is possible. So the average age of menopause is menopause, meaning your ovaries are done, shut down. Okay, is 51. Normal is still 45 to 55. Okay, there's the curve. All right. Perimenopausal symptoms, the decrease in estrogen production leading to symptoms can begin 7 to 10 years before that time. So remember, 45 is the earliest, back up 10 years, 35. So somewhere in your late 30s, you are going to have estrogen levels decreasing to the point where it is causing you some kind of symptom. What is the ratio? It is the waist to hip ratio, okay? So here is Mary Claire's waist. Whew, this is not attractive, okay. So for some people, it's their belly button. I have a high waist, meaning it's way above my belly button. It's up here right under my ribs. So you take your waist, the smallest part of you. Now, if you only go out, that's fine. Pick your belly button. Just go with that. And you divide it by your hip, where your booty sticks out, okay? Right there. So the widest part by the smallest part, and you divide those two and it doesn't matter inches or centimeters as long as it's consistent, okay? And you divide those two, and it's the waist divided by the hip. If it is less than like 0.8 in a woman, you're rocking the house. You are good. That means you can, pear shapes are healthier than apples. Sorry, that is just nutritional fact. And if you are greater than 0.85, you're at risk. If you're greater than 1, most likely you have a significant amount of visceral fat that is leading to increasing your health risk dramatically. So, oh, nice abs. It's work. I'm 53. Nutrition and exercise. I got no magic. My genetics ran out a long time ago. I'll show you some of my siblings that are still alive. I've lost 3. So yeah, Jude died last year, and my dad. It's been Suck City over here. Daddy died of COPD in old age. He was 87. And Jude died from esophageal cancer that was widely metastatic. He had brain mets, bone mets, liver mets. They were everywhere. And he had palatal mets. Okay, so questions, drop them in here. What is the magnesium supplement I recommend? Well, there are multiple forms of magnesium, and they all work a little bit different. So it depends on what you're trying to do with it. Are you trying to replace 70% of Americans are not getting enough magnesium in their diets? Did you know that? So if you're trying to replace a deficit, then you use something like magnesium glycinate or mag citrate, I think. Mag oxide makes you poop. And so that's not readily absorbed into the bloodstream. Most of it stays in the colon and causes you to empty your bowels. And so it is used for diarrhea or to move for constipation. Magnesium L-threonate or Magtine or Neuromag is the form that most readily crosses the blood-brain barrier. Thank you for the roses, y'all. Thank you for the likes and the gifts. Keep them coming. Helps me stay relevant on this platform. So I do not have a deficiency. I track my nutrition. I know I'm getting enough mag in my diet because I eat mostly plant-based with some meat here, and I eat very little processed foods and almost no added sugars. And so the mag L-threonate helps me sleep, and it helps with anxiety and depression. There is a wonderful study, I have a TikTok about it, that in treatment-resistant depression, Magtine, mag L-threonate was shown to have really good results with the patients with treatment-resistant depression. So that is all good. Let's see. Thoughts on hysterectomy for fibroids? We don't have a lot of great options for fibroids. You only need them removed if they're causing you problems. 70% of us have fibroids, but most of us don't know it because they're not bothering us. So we just leave them alone, okay? But if they are causing pain, excessive bleeding, infertility, blah, 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 you can remove the fibroid. But if you're done having children, most surgeons would agree to remove the uterus and just get rid of it all. There are uterine artery embolizations. There are other treatments and therapies that you can consider. But hysterectomy for fibroids is definitely an option. Let's see. How do you know if you're deficient in magnesium? Okay, so I get these questions a lot. Things like mag and potassium and sodium, the electrolytes, they fluctuate minute to minute. So like you get a one-time blood test, it doesn't mean you've been deficient your whole life. Just in that moment, you're deficient because your body's constantly excreting them in the urine. Okay, they're water soluble. We don't store them in fat. K, A, D, and E are fat soluble, so you can become toxic from over storage because they're stored in our fat cells. Okay, You really have to watch how much Ka, D, and E that you ingest. Mag, in the hospital, when we happen to get someone who's mag deficient, we just give an IV full of mag and send them on their way. Or maybe give them some mag oxide or, mag citrate, something to take orally for a few days. Now, severely low mag or severely high mag can cause, the heart not to beat correctly and lots of medical problems. But the way that I tell my patients is you need to track. You need to track your nutrition, download one of those free trackers. Chronometer is my favorite, and look at what you're eating and see if you are deficient. You see if you're meeting the daily recommended intake, and it's all loaded into it's loaded in a chronometer for sure. Chronometer is a nutrition database. It is not a diet database, different than MyFitnessPal, which is for calories, or a Carb Manager, which I've liked in the past. But their databases are, people can upload their own recipes and stuff to it, and that's nice, but it corrupts the data. So you could click on a piece of salmon or a grape or something and not get the correct nutritional information. Whereas Chronometer, they do not allow, you cannot upload anything to their nutritional database. They know everything in there is correct as it could be. Okay. So if you want to learn more about the Galveston diet and go and consider the sale or go check it out, you can go to galvestondiet.com, or you can just click up here at Galveston Diet and go to the link in bio. You can take our inflammation quiz, which is amazing. And if you think you're in perimenopause, but we're not really taught much about perimenopause in training, at least in my training. And I left the residency, 2018, I was still a professor. And so I know that we weren't doing a lot of education about perimenopause and how to recognize it, the nuances of treating it. It's very, very nuanced. And it wasn't until I went through that I was like, we are doing something really wrong because these women are suffering. And we're telling them, you're too young, or I can't do anything till your period stop for a year. Not true. Not true. They're just not taught. They're not bad people. They're not bad doctors. This is not part of the routine curriculum. And I had to go and get training on my own to figure this out. To be able to help my patients to the best of my ability. Okay. Signs of perimenopause, go take the quiz. Go take the quiz. There are 34 signs. This quiz covers about 12. It could blow your mind. It'll tell you the likelihood that you are suffering from perimenopause based on the quiz. Let's see. Intermittent keto be dangerous, going on off weekly. Why are you doing that? Keto, the way most people do it, is highly inflammatory. Remember, your nutrition counts. The quality of your nutrition counts. And if you're doing keto the traditional way, it is very, very, very pro-inflammatory. Just go look at some of our blogs and you can hopefully make some changes that will be sustainable for the long term it's not weight loss at any cost. Don't get yourself into that mindset. Let go of the scale. It is health. It is good health. It is living your best life at whatever size that's going to be. Let go of that number on the scale. It will kill you faster. Trying to get to that number will likely for most of us, will undermine our best health, the best that we can be. It is not too late for HRT. It is not too late if you've been menopausal for 4 years. Not too late. Find a provider who's going to take care of you. Let's see. Thoughts on intermittent fasting? Girl, you missed the beginning of this talk. I am a huge fan. I have multiple blogs. I have multiple videos about this. Check it out at galvestondiet.com. Search on intermittent fasting, and I have lots of information, links to medical journal articles, everything there you need to educate yourself. Okay. All right, guys, I'm going to jump off. Give me some taps on the way out. Thank you so much for being a wonderful audience, and we will chat again soon.